What to do if you are infected by coronavirus? Steps to help prevent the spread of COVID-19 if you are sick. With COVID-19 or think you might have COVID-19, follow the steps below to care for yourself and to help protect other people in your home and community. Stay home. Most people with COVID-19 have mild illness and are able to recover at home without medical care. Do not leave your home, except to get medical care. Do not visit public areas. Stay in touch with your doctor. Call before you get medical care. Be sure to get care if you have trouble breathing, or have any other emergency warning signs, or if you think it is an emergency. Avoid public transportation. Avoid using public transportation, ride-sharing, or taxis. Separate yourself from other people in your home. This is known as home isolation. Stay away from others. As much as possible, you stay away from others. You should stay in a specific sick room if possible, and away from other people in your home. Use a separate bathroom, if available. If you are sick, you should wear a face mask, if available, when you are around other people, including before you enter a healthcare provider's office. If you are caring for others, if the person who is sick is not able to wear a face mask, for example, because it causes trouble breathing, then as their caregiver, you should wear a face mask when in the same room with them. Visitors, other than caregivers, are not recommended. Note: during a public health emergency, face masks may be reserved for healthcare workers. You may need to improvise a face mask using a scarf or bandana. Cover your coughs and sneezes. Cover your mouth and nose with a tissue when you cough or sneeze. Dispose, throw used tissues in a lined trash can. Wash hands. Immediately wash your hands with soap and water for at least 20 seconds. If soap and water are not available, clean your hands with an alcohol-based hand sanitizer that contains at least 60% alcohol. Clean your hands often. Wash hands. Wash your hands often with soap and water for at least 20 seconds. This is especially important after blowing your nose, coughing, or sneezing, going to the bathroom, and before eating or preparing food. Hand sanitizer. If soap and water are not available, use an alcohol-based hand sanitizer with at least 60% alcohol, covering all surfaces of your hands and rubbing them together until they feel dry. Soap and water. Soap and water are the best option, especially if hands are visibly dirty. Avoid touching. Avoid touching your eyes, nose, and mouth with unwashed hands. Avoid sharing personal household items. Do not share. Do not share dishes, drinking glasses, cups, eating utensils, towels, or bedding with other people in your home. Wash thoroughly after use. After using these items, wash them thoroughly with soap and water or put in the dishwasher. Clean all high-touch surfaces every day. Clean high-touch surfaces in your isolation area, sick room and bathroom, every day. Let a caregiver clean and disinfect high-touch surfaces in other areas of the home. Clean and disinfect. Routinely clean high-touch surfaces in your sick room and bathroom. Let someone else clean and disinfect surfaces in common areas, but not your bedroom and bathroom. If a caregiver or other person needs to clean and disinfect a sick person's bedroom or bathroom, they should do so on an as-needed basis. The caregiver/other person should wear a mask and wait as long as possible after the sick person has used the bathroom. High-touch surfaces include phones, remote controls, counters, tabletops, doorknobs, bathroom fixtures, toilets, keyboards, tablets, and bedside tables. Clean and disinfect areas that may have blood, stool, or body fluids on them. Household cleaners and disinfectants. Clean the area or item with soap and water or another detergent if it is dirty. Then, Use a household disinfectant. Be sure to follow the instructions on the label to ensure safe and effective use of the product. Many products recommend keeping the surface wet for several minutes to ensure germs are killed. Many also recommend precautions such as wearing gloves and making sure you have good ventilation during use of the product. Monitor your symptoms. Common symptoms of COVID-19 include fever and cough. Trouble breathing is a more serious symptom that means you should get medical attention. If you are having trouble breathing, seek medical attention, but call first. Call your doctor or emergency room before going in and tell them your symptoms. They will tell you what to do. Wear a face mask. If available, put on a face mask before you enter the building. If you can't put on a face mask, cover your coughs and sneezes. Try to stay at least 6 feet away from other people. This will help protect the people in the office or waiting room. Follow care instructions from your healthcare provider and local health department. When to seek medical attention. If you develop emergency warning signs for COVID-19, get medical attention immediately. Emergency warning signs include trouble breathing, persistent pain or pressure in the chest, new confusion or inability to arouse, bluish lips or face,